देखिए, भले ही डॉक्टर विश्वरूप चौधरी सर के जितने भी प्रोटोकॉल्स या उनकी नई नई टेक्निक्स हैं, भारत की अथॉरिटी द्वारा बेशक इनको उतना सपोर्ट नहीं मिलता जितना मिलना चाहिए, लेकिन डॉक्टर B.R. सर के तमाम प्रोटोकॉल्स का अब विदेशों में डंका बज रहा है। जी हाँ, तो अभी देखिए आप मेरे सामने फ्रेम में है डॉक्टर नरजीत सिंह जो मलेशिया में हैं और उनके साथ उनकी टीम भी है। मैं चाहूँगा 2 मिनट पहले आप अपनी टीम के बारे में हमारी जनता को जरा बताएं और आप अपने बारे में बताएं, फिर आगे की चर्चा शुरू करेंगे। डॉक्टर साहब
बहुत बहुत शुक्रिया। एक बात है, मगर जो भी काम डॉक्टर विश्वरूप कर रहे हैं बहुत डिफरेंट और अलग काम कर रहे हैं। और किन लोगों के लिए काम कर रहे हैं? आप लोगों के लिए, सबके लिए। ठीक है। अब हमारी टीम जो यहाँ प्रोफेसर फर्नांडो आए हैं, ये ऑस्ट्रेलिया के हैं और अभी इंडोनेशिया में भी काम कर रहे हैं। ये है मैडम उता और ये जर्मनी के हैं, अभी सिंगापुर में भी काम कर रहे हैं। ये सब, ये तो मेन स्ट्रीम के प्रोफेसर भी है और ऑल्टरनेटिव मेडिसिन जो बोलते हैं, ग्रीन मेडिसिन बोलते हैं, जो जैसे यहाँ आयुर्वेदा है वो करते हैं। ये मैडम उता जर्मनी से नेचुरोपैथ है। नेचुरोपैथ का मतलब आप सब जानते हैं, जो नेचुरल चीज़ों से ही खा के जो मतलब समय से ठीक हो सकते हैं। और ये जर्मनी के हैं, अभी सिंगापुर में भी काम कर रहे हैं। ये सब, ये तो मेन स्ट्रीम के प्रोफेसर भी है और ऑल्टरनेटिव मेडिसिन जो बोलते हैं, ग्रीन मेडिसिन बोलते हैं, जो जैसे यहाँ आयुर्वेदा है वो करते हैं। ये मैडम उता जर्मनी से नेचुरोपैथ है। नेचुरोपैथ का मतलब आप सब जानते हैं, जो नेचुरल चीज़ों से ही खा के जो मतलब समय से ठीक हो सकते हैं। और हमारी टीम इन डॉक्टर विश्वरूप को कुछ प्रिंसिपल फॉलो करने के लिए, डॉक्टर विश्वरूप हमको एक ही बात बोलना चाहते हैं, अगर हम सब लोग जहाँ भी है, जो भी कर रहे हैं, एक प्रिंसिपल फॉलो करें। और वो प्रिंसिपल क्या? सूरज जब निकलता है और जब छिपता है, खाना उस समय खाएं। 9 बजे सुबह से 6 बजे तक बस जो भी खाना है खाइए, कोई एतराज़ नहीं है। मगर ये एक मतलब सूरज 9 बजे सुबह और 6 बजे तक खाना है, खाओ जो खाना है। और 1-2 महीने में देखेंगे आपका क्या बदलाव आता है, शरीर में बदलाव आता है, क्या डिफरेंस आएगा। और एक ही ये मतलब डॉक्टर विश्वरूप बोलते हैं, सर्काडियन साइकिल से खाओ। जब पहले इलेक्ट्रिसिटी नहीं थी तो क्या करते थे हम सब लोग यहाँ गांव में? क्या करते थे? खाना कब खत्म करना चाहिए? सूरज छिपने से पहले। ठीक है ना? यही तो एक प्रिंसिपल, जो अभी ये बिजली आ गई है, मॉडर्न इलेक्ट्रिसिटी आ गई है, मॉडर्न इलेक्ट्रिसिटी आ गई है, मॉडर्न तरीके आ गए हैं, तो मॉडर्न डिजीजेस भी आएंगे। जैसे HIV आ गया, ये कोविड आ गया, कैंसर आ गया। तो क्या करें? अगर आप सब लोग एकदम स्वस्थ हेल्थी रहना चाहते हैं और डिजीज से दूर, मतलब यही एक प्रिंसिपल इनका फॉलो कर ले, अब सबका भला होगा। यही एक मैसेज हम आप सब लोगों को।
डॉक्टर नेजी जी, मैंने लास्ट टाइम हमसे मुलाकात हुई थी, आपने बताया डॉक्टर साहब के साथ मिल करके जो आप मलेशिया में इस तरह से प्रचार प्रसार किया है और अपने पेशेंट पर भी डॉक्टर विश्वरूप की टेक्निक आपने अपनाई है। मैं अब आपका एक्सपीरियंस भी जानना चाहूँगा और जो आपने विश्वास दिखाया, जो कि बहुत कम लोगों में देखने को मिलता है कि डॉक्टर B.R. सर को बहुत सारे आलोचक ये बोल देते हैं कि इनके दावों में कोई सच्चाई नहीं है। मैं आपसे पर्सनली आपके एक्सपीरियंस के बाद जानना चाहूँगा कितनी सच्चाई है डॉक्टर विश्वरूप जी के प्रोटोकॉल्स और टेक्निक में।
अरे देखिए, मतलब ये मतलब जो भी कुछ नया निकालते हैं, सोचते हैं, भला करते हैं, तो ऑपोजिशन तो आएगी। ये कोई नई बात नहीं है, ये तो बहुत पुरानी बात है। मतलब लोग इसे विरुद्ध करेंगे, ये ठीक नहीं है, वो ठीक नहीं है। मगर एक चीज़ मैं बोलता हूँ, क्या डॉक्टर लोग को हार्ट अटैक होता है या नहीं होता है? डॉक्टर लोग को कैंसर होता है कि नहीं होता है? डॉक्टर लोग को स्ट्रोक होता है? क्यों? अगर हमारी यही मेडिसिन जो हम बोलते हैं एलोपैथी है इतनी अच्छी है तो डॉक्टर लोग कोई नहीं इन तीनों बीमारियों से मरना चाहिए। आप ही खुद सोचिए क्यों डॉक्टर लोग मर रहे हैं। इसका मतलब जो हम लोग एलोपैथी में काम कर रहे हैं इसमें कोई शॉर्ट कमिंग्स है, पूरी मतलब विद्या नहीं है। तो शॉर्ट कमिंग विद्या पूरी नहीं है तो क्या करें। यही तो विश्वरूप बोल रहे हैं भाई 5000 ईयर्स पहले 5000 ईयर्स पीछे जाओ, हमारे गुरु लोगों ने क्या बोला था, आयुर्वेदा से सीखो। बस यही सिंपल बात है और क्या इसे विरोध करना है। आप लोग देखने रहे हैं अगर टाइप 1 डायबिटीज लोग ठीक हो रहे हैं, इनको सपोर्ट करने से बजाय लोग इसको पुल डाउन कर रहे हैं, क्या फायदा है। एक ही मुझे लगता है सब मालक पैसा रोक रहा इज किंग, यही है ना। तो अगर आपके बच्चे को ऐसा हो जाएगा तो क्या आपको सबको पैसा है, क्या आप फैमिली को ऐसे चाहिए कि मतलब आपकी फैमिली बीमार हो रहे और हेल्थी ना रहे। नहीं, सब लोग यही सोचते हैं कि मेरी फैमिली हेल्थी होना चाहिए। ठीक है, सिंपल चीज़ है। तो हम सब बोलते हैं अरे ये क्यों कर रहे हैं, ईगो है, पैसा है, इसको पीछे रखो, ये अहंकार है ना, इसको पीछे रखो तो सब लोग ठीक हो जाएंगे।
बिल्कुल। अच्छा, लास्ट में मैं जानना चाहूँगा कुछ संक्षिप्त में आप बताएं जरा आगे के फ्यूचर प्लान्स आपके क्या हैं डॉक्टर विश्वरूप जी के टेक्निक्स और प्रोटोकॉल्स को लेकर के।
देखिए ये जो काम है ना बहुत बड़ा काम है, ये छोटा काम नहीं है। कि मतलब जितने भी मतलब 70% जहाँ भी मतलब मुल्क में बहुत डेथ होती है किस वजह से होती है, कैंसर से होती है, हार्ट अटैक से होती है, डायबिटीज से होती है ना। अगर इनको रिवर्स करना क्या है, ये बच्चों का खेल है नहीं, इसीलिए सब प्रोफेसर लोगों को बुलाया आन के देखो इधर क्या कर रहे हैं और इसको कैसे यूनिवर्सिटी लेवल तक लेके जाना चाहिए, दूसरे हॉस्पिटल तक लेके जाना चाहिए। क्योंकि जो भी मतलब यहाँ विश्वरूप कर रहे हैं इसको मतलब दूसरे डॉक्टर लोग सब समझ सके और सब साथ में मिलकर हम लोग एक ही है, सब दुनिया को तंदुरुस्त स्वस्थ रखें, यही हमारा एक प्रिंसिपल है और इन लोगों के साथ हम कर रहे हैं बस। और क्या है, हम ये नहीं चाहते कि हमको टाइटल मिलना चाहिए, ये मिलना चाहिए और नहीं, कुछ नहीं है।
Hello, Uta. You are from Germany and you are a holistic medicine practitioner, right? Tell me something about yourself.
So I make my holistic medicine exam in Germany, and since 9 years I'm in Singapore. In the last 3 years I have my own clinic called Therapeutic House.
Okay. Uta, you have come to HIMSS Merit right now, okay? And trying to understand the protocol set up by Dr. B.R.C, like hot water immersion therapy, zero volt therapy, head down tilt therapy. And I think this is your second visit. At first you were in HIMSS Mumbai.
Yes, and
right?
now
And along with that, you have enrolled in a course, Circadian Clock and Ayurvedic Panchkarma too, right? So I just wanted to know about your comment, about your, plans next for this HIMSS.
So thank you for asking, because it's very interesting how you build up these clinics, because it's integrative and you have different kind of medicine fields here. So, but the main part which I like is that you educate the clients or the patients to take care of themselves and take back the responsibility to be healthy or to get healthy and to stay healthy. So, and I think this is the main important part, that everybody must understand they are responsible for themselves. And the education here is in a way that everybody can, even at home, practice everything after the teaching or the education from here. So, and you give all the informations to everybody so that they actually are able to go home and to take care of themselves.
Uta, how will you take this work to the rest of the world, like Germany, and to the place where you're working presently in Singapore?
Okay, I will start in Singapore because I'm living there in the moment and have my office there. So I try, or I actually will do or bring some of the therapies like 0-volt mattress, like hot water immersion or so. This we can bring there because clients can do this at home.
Yeah.
So, and slowly, I think when I even introduce the books, so, and because the books are free, yeah, so, and everybody can read English, so I can even forward the books to the clients so that they get used to the name Dr. Biswarup and about the ideas. So, and I hope that even the old ideas about flu and DIP diet and all this one, which are proved already, so that they slowly can get into the mind of people that there's another possibility of curing things. And because my clients are open for all this, that's why they see me as an alternative medicine practitioner. I think that I have the chance to implement this and even the name.
Uta, would you like to give any message to the audience?
Yes, please. Be patient with your body, give yourself a little bit the chance, and be open-hearted and open-minded to all the new ideas, because I think this is so amazing what you can achieve when you follow whatever is taught here or what Dr. Biswarup tried to say. And he's a little bit like Buddha. He said, don't believe me what I tell you, try it out first, and when you practice this and you experience this, then you can transfer it to others.
Okay, thank you. Hello, Dr. Fernando. You have experienced both the world, like both of world of clinical trial, world of modern medicines, world of pharmaceutical, world of modern medicines. And you have been experiencing this modern medicine since last 25 years and visited across the world, right?
Correct.
Yeah, and now you have landed into a HIMSS merit, where you have experienced different therapies, grad system, like
Right.
0-volt therapy, hot water immersion therapy, or head down tilt therapy.
That's right.
So what do you think? You have talked to patients also.
Mm-hmm.
So what are your thinking, what are your comments about this?
Okay, thank you for inviting me.
Yeah.
I'm certainly very excited to be here. You know, we came, in reality, I will tell you the truth, we came because internationally we are facing a crisis, right? And the crisis is that we have no method. Our society has no way to control and support the patients that end up in a terminal chronic kidney disease stage. Normally it's called stage 4, you know, which leads to dialysis. So there is a crisis, certainly. There's a crisis in Asia, and there's a crisis in many other countries, Europe, United States, and African countries, and South America. So I was very excited to be introduced to HIMSS by Dr. Najit, who spoke to me about this incredible program that appears to have fantastic results for these patients. So I definitely said, I'm on board, I want to come and have a look. And we're going to look at everything critically and objectively. And we did that. And we continue to do that as we speak. We spent several days getting to know the program, getting to know the various aspects of the program, and also getting to know Dr. RBC himself, and also get to know all his staff and the doctors, and also talking to patients as well. So, and my intention was to review all the clinical data, to review the paperwork, review the findings, to make sure that what we have here is something that can be substantial, it can be consolidated, and can be corroborated. Right?
Yeah.
And to tell you the truth, my answer to you is, I'm very excited, really am.
Okay, good to hear about that.
I'm excited because this is a challenge that I think we all have to face sooner or later in our lives, and regardless of what we do, we will meet each other at a point in life where we have some intractable disease that we cannot control.
Okay.
And working along those lines to be able to prevent and even to treat these diseases effectively is really a success.
Okay.
So I think the program, perhaps we can discuss a little bit about the program later on with other people that know more than me, but what I have seen so far is that it is a comprehensive system. It's actually taking a perspective that the patient is in fact in charge of his own life and is in charge of his own future, right? And the patient must make a decision to seek for improvement and resolution and possibly a cure, right? So, and we like that approach because that's the approach that hands over the responsibility to the individual, right?
Okay.
So the individual can make decisions. So the program is comprehensive. It's structured in such a way so that it's not difficult for patients to carry through. In fact, they seem to be enjoying the process, to be honest. It's not something that is difficult to do. It's not hard to do. It does require a certain amount of a little bit of discipline and a commitment to the process.
Determination.
Determination, absolutely right. But I think that the patients in general seem to be very much like a family in there, and they seem to be going through the process without stress. So I didn't see any level of stress in there. And I think that what we're beginning to see is that the program runs for around 72 hours, 3 days, and then it doesn't end there. The patient must go home and continue that process.
Yeah, they have to.
Yeah.
They have to.
Continue and be responsible for the outcome in the end. And I think that what the data that I see is very encouraging. There's significant improvement in many of these chronic diseases patients, right? And we're talking about, dialysis patients. We're talking about type 1 diabetes, type 2 diabetes. We're talking about cancers. We're talking about most diseases that are currently the biggest scourge in humanity, right? These are the major killers around the world and continue to be so. So we're very excited, and we wish the team great success in the future.
What are your plans about these therapies, like hot water immersion therapies or this head down tilt therapy for kidney patients? And how would you take these therapies, Dr. B's therapies, to the rest of the world?
Well, that's our next step, naturally. Once we learn enough about the program and we are confident that all the information that we see can be reproduced, and we're in that process, and we're confident that we will reproduce everything and confirm everything that we find. Certainly, I'm just a part of a team which is being led by Dr. Narjit from Malaysia, from the My Life Center, and so I intend to present all my support, all my experience, all the learning that we've done over the last 25, 30 years, and trying to bring this program, this technology, to the rest of the world. So we're going to start, obviously, in Asia. We hope that we can actually expand to other countries, such as Australia. We're very determined to do that. We like to expand to countries that are perhaps in the most need of this type of work.
Okay.
So that is an affordable program that can be actually done successfully without major stress for the patient and his families, right, and the families of the patients. And so we intend to take one step at a time. We'll target Malaysia as first step, perhaps move forward to Indonesia as well, because we find Indonesia has a significant degree of chronic diseases that need to be supported, that need to be controlled, right? And so we're excited, we have a plan, and then hopefully we'll be able to talk later on with you about our success in the future and future plans as well.
Okay. What are your opinion about Dr. B.R.C. and his work? Do you think it is promising? His therapies are promising?
Well, that's a very interesting question. Now, I have to tell you that I've only met him a couple of times. We had some very interesting conversations, very lengthy conversations. But what I can see there is that I even made a point myself to him that I feel that what's emerging from here is a major movement of people, of energy, that is intended to bring resolution to the suffering of many. And so I think that he is a visionary, right? I think that he's a man with a great degree of commitment to this process, which is quite remarkable. Money is an issue, but it's not really an issue. It's just by the way. And that's extremely important for me, because I feel that I tend to look at people and what motivates them to do certain things. Now, B.R.C., Dr. B.R.C. appears to be extremely dedicated to this with passion. He's very focused on the work that he's doing, and I can see his sense of humanity, his connection with the patients is quite remarkable. I don't see it often. with our similar physicians, doctors, scientists, right? But he's quite committed to making this happen and bring to all humanity, essentially.
Okay.
The other suggestion you asked me about, if I had any other suggestions about.
Yeah, do you have some suggestion which can help us to improve and reach more and more people?
Well, we will be able. We're in a learning curve at the moment, so we have our own experience, our own perspective, and objectives in terms of how we like to do things. But we want to learn as much as possible on this program, on Dr. B.R.C. program, and as we learn, we will be able to make some contributions, some suggestions, perhaps to help. To allow the program to be perhaps more acceptable overseas. So there's differences, India has a very rich culture, very strong, very rich culture.
Ancient culture.
Absolutely.
Yeah.
And so, other countries have completely different experience. So one of the things that will help a great deal is to bring more awareness about the Indian approach, for example, Ayurvedic medicine approach to health. Because it exists, in Australia, it exists in many other countries, but it's not extensive, it's not widespread. So I think that maybe there'll come a time when we'll have to show the world what's available. And then Ayurvedic medicine is one of those resources that we're not really fully tapping into it, right? We're not really utilizing the power of Ayurvedic medicine, like we are not using the power of nature also, right? Which is in the same type of situation. So my suggestion is that we keep working hard, we keep trying hard, and we try to adapt to each particular country to deal with the differences in each country. That would be my only advice.
Okay, thank you, Dr. Fernando. Hello, Dr. Natri. Recently, you have signed MOU with Dr. B.R.C.
Yes.
And in collaboration with him, you are going to initiate these therapies in your center, My Life Center in Malaysia.
Yes.
Right? And you have revisited this HIMSS along with your team.
Correct.
Right? And you have learned our therapies in depth now. You know every therapy like 0-volt therapy, GRAD system, and hot water immersion therapy.
Yes.
Once you will go back to Malaysia, what are your plans and what do you think about these therapies? These therapies are promising. Give me your views, please.
Well, let me give a compliment first to Dr. Viswarup and his team and all the doctors and medical team at HIMSS, because what you people have done, no one has done. Right? This is a very unique way of learning, and how I met Dr. Viswarup, because especially when you're talking about thalassemia reversals, diabetes, type 1, type 2, yes, there are people who are doing it, like Dr. Jason Fung in Canada, he has reversed so many type 2, but type 1 is not an easy baby to deal with. And here, what we are seeing is that they have some very good results. I wouldn't say 100%, at least 60-70% of good reversals in type 1. And that is a medical breakthrough, I would say. Right? And that is what we are coming here. I came here with my team, Professor Fernando, right, who is one of the pioneers and early leaders in integrative medicine. Right? That's why we brought him. We saw the patients. We are very interested. Now, how do we take the program to another level into the international and to the Western world? What we decide that we are going to put into a university level, we can call it first experimental medicine, or we are going to call it research and development under experimental medicine in a university, and we have planned to do it with one of the universities in Indonesia, in Medan, called University Prima. This University Prima is founded by a very close doctor and a friend of mine, Dr. Newman. In fact, Dr. Newman and his son were supposed to come, but because of certain other commitments, what you call, I'll be signing a contract, an agreement tomorrow with Dr. Biswarup that both hospitals, his university, his hospital, and we're going to liaise with the HIIMS, both. So once this contract has been signed, then Dr. Biswarup is going to come to Malaysia in September, as he's going to give a conference on MAFIM, that is Malaysian Association of Advanced Functional Integrated Medicine, and then we'll go to Medan. He'll meet, and that's where we are going to start the foundation. Whatever we have done in HIMSS here, we are going to start a foundation, and we'll start doing our own work as taught by Biswarup. Now, in this medical college plus university, because there are a lot of doctors, students, so we'll be doing a real research work on the various angles and everything.
Okay, thank you.
So that's our big plan, or you can call it a small plan, in a big way.
Okay, good.
Right.
And any message you would like to give to the audience?
Audience now. You see, my life center, I'm from my life center, and my life center basically I focus on the 3 big C's, which I also told last time. And I'm one of the first doctors who has said I'm the green medicine practicing doctor, that is prevention. First, to all the people, all the doctors, are doctors now dying from cancers? No, they are dying. Are doctors not getting heart attack? They are dying from heart attack. Are doctors not getting strokes? They are getting strokes. Why? If our Western medicine was so good, then the doctors should not be dying.
Yeah.
But when they are dying, it is very sad that something is lacking in our mainstream medicine. And that's where it took me and thinking, go back, where Mother Teresa told me, whenever you have any problem, go back to nature and understand. That's where green medicine comes in preventive. And exactly, Dr. Biswarup has taught us so many more things. Going back 5,000 years ago on the basis and principles of Ayurveda. And Ayurveda also says, go to natural things, do no harm to thy patient, right? And which is also in line with the father of medicine, Hippocrates. First, he said, let food be thy medicine and medicine be thy food. Second principle is, do no harm to thy patient. So exactly we are following the simple rules. You eat good food, nutritious food, healthy food, free from chemicals, insecticides, pesticides, you will be healthy. And they must not be refined and processed.
Yeah.
The problem is refined, processed, chemicalized. When you do all this, all the nutrients are taken away from the food, then how can that food be healthy? Now, young children these days are getting cancers. Have you not heard that someone 2 years, 3 years have got cancer?
Yeah.
How did they get cancer? From where did that cancer come? Now, right? They have not even started eating properly. They don't even smoke. They don't even do anything. And from where did this cancer come? That means the mother was not eating properly or the parents were not eating properly. So you see, you go back how much of problems we have created. So we are trying to gather the message to the community, look for good food. In fact, all the people now, you should be planting your own vegetables in the background, on your rooftop or anywhere, because you can't trust anyone these days. You go and buy any food, they will say, the labels may not say anything, but can you trust them? No. So how do you want to be healthy? Plant your own food in your background. Kitchen garden, you can call it kitchen garden, background garden, and you don't need so much of things, So the message, grow your own vegetables, food, be healthy, be happy, free of all the chemicals and so forth.